I'm chair of the all-party group on alcohol, drugs and justice. So I was very keen to support the application to the backbench committee. And there are a number of points I'd like to make on behalf of the all-party group, now that we have the Minister. But I'd also like to make some reflections on the impact of alcohol in the North East, and particularly in my own constituency of Easington, where alcohol is devastating lives and families. Rates of alcohol-related hospital admissions, deaths, traffic collisions are all worse than the national average in my constituency. We often obsess over statistics, but behind the statistics are real people, families and communities suffering from largely preventable harms. And that's the thing about both drug deaths and alcohol deaths and cancers related to drugs and alcohol. They are preventable. So my argument, and that of the all-party group, is that we must take the risks of alcohol far more seriously. As my honourable friends just said, the #1 risk factor for ill health, death and disability among those aged 15 to 49, and its links with cancer. Alcohol is the #1 risk factor in that age group. Isn't that incredible? 15 to 49. And there's a clear correlation with cancers. My honourable friends indicated the types of cancers, so I'm not going to repeat that. And I would like to say that while alcohol has always been part of society, the rates of higher risk drinking soared during the pandemic. I think my honourable friend for Strangford and my good and honourable friend for Lancaster and Wyre Valley have mentioned this. And perhaps that's understandable, Mr Stewart, because the circumstances had changed. Many more people were working from home, and consumption at home increased. However, we've seen little sign of returning to pre-pandemic levels of alcohol consumption. And if these trends continue, experts are predicting an additional 18,785 cancer cases, a very precise prediction, I know, by 2035. And the predicted rise is deeply concerning, given that the NHS is already struggling to meet the UK's current cancer burden. Myself and the Honourable Member for Strangford have a particular interest in the all-party groups on cancer, in particular radiotherapy. And we're aware that in April of this year, only 70.8% of cancer patients in my constituency were being treated within the 62-day target, compared to the operational standard target of 85%. And once again, behind these missed targets, people in my constituency, across the North East and across the country, are waiting anxiously for diagnosis and treatment. There's a clear correlation between deprivation and alcohol consumption. These two seem to go hand in hand. Researchers connect alcohol consumption to inequalities in life expectancy. People in poorer areas tend to live shorter lives than those in more affluent areas. There's also a link with violence, especially against women and girls, a decline in social and emotional well-being, and indeed in child development. So the human cost is immeasurable, but the financial cost is also huge, and it is possible to calculate it. Alcohol harm costs County Durham £277 million per year. That's over £530 per head. Across the North East, the total cost is estimated at £1.49 billion, almost £1.5 billion per year. These figures are stark, but they are not inevitable. All of these costs are avoidable. And research by Cancer UK shows that around 2,700 cancer cases in England could be avoided by 2040 if just 10% of those drinking above the recommended levels reduce their intake by one intake category by 2030. There's no doubt about it, cutting down on alcohol can reduce your risk of cancer. How do we reduce alcohol harm? Well, the Alcohol Health Alliance and the World Cancer Research Fund have both set out some clear solutions, tackling affordability, promotion and availability. And while I acknowledge and welcome the government's 10-year health plan released just last week, it announced only limited measures on alcohol. Commitments on labelling are welcome, but they do not go far enough and are not proportionate to the scale of the crisis. So, respectfully, I would urge the Minister to consider further measures in advance of the National Cancer Plan expected to be published in the autumn, and to work with harm reduction organisations who are experts in this field and go further. Way Through is one of the treatment providers that provides support to those suffering from excesses of alcohol. And they're also involved in the APPG that I chair. And the chief exec, who's called Paul Townsley, said, alcohol treatment, if I may quote, alcohol treatment and recovery support has a transformative impact on people, families and communities. We urgently need government to commit to a national alcohol strategy that increases investment in treatment and recovery, evidence-based prevention, and addresses the root cause of alcohol harm that devastates our communities so unequally. A little later today, Mr Stewart, the All-Party Group on Drugs, Alcohol and Justice, which I mentioned at Chair, will be launching a new Action on Alcohol document, which echoes the calls that have been made in here and elsewhere for an alcohol strategy. Back in 2018, just next door, in the Jubilee Room, in fact, I attended the launch of the Alcohol Charter, which made the very same demand. But let's not forget, as the Honourable Member for Strangford reminded us, the last alcohol strategy was issued in 2012, and since then, the alcohol death rate has spiralled. So I'd be grateful if the Minister could outline any plans she has to develop a cross-governmental alcohol strategy, cross-government department alcohol strategy. I would like to ask as well, if I may use this opportunity, to ask whether the Minister would meet with me and treatment providers who support the All-Party Group on this issue, and perhaps we could discuss some of the potential solutions. And I would politely, gently remind the Minister that she did agree to meet with the APPG on drugs policy back in March, and we still haven't been able to finalise the date for that meeting. In my region, Mr Stewart, the organisation Balance does exceptional work in reducing alcohol harm, and it's currently the UK's only regional alcohol prevention programme. Alcohol abuse is a huge societal problem in the North East, and it should be at the forefront of shaping policy to reduce alcohol harm. Balance joins many voices across the sector in calling for a new, dedicated alcohol strategy, one that prioritises proven measures to reduce the affordability, availability and promotion of alcohol. There is a clear consensus among alcohol and cancer charities that this is urgently needed. The government must introduce a comprehensive alcohol strategy without delay. The UK has not had a national alcohol strategy since 2012, and we must catch up with global leaders and show that this government is serious about tackling alcohol harm. So with respect, I urge the Minister to commit to a comprehensive alcohol strategy that tackles this crisis head-on, protecting lives, reducing cancer risk and lifting the burden from our NHS and our communities. Thank you.